I'm Diane Christand. I serve on the NAMI South Mountains, North Carolina Board of Directors as president. I also now serve on NAMI North Carolina Board of Directors state president as well. Been involved with NAMI for over 20 years. NAMI was my savior and grace back when my son would first be diagnosed with bipolar disorder. And during that time, I was able to attend a NAMI family-to-family class, which was a support system for me, no judgment, sharing my story, and just hearing others say that they had the same things going on. And they said, Diane, never lose hope. And those words have stuck with me for over 20 years. And I wanted to give back to NAMI, so that's why I volunteer today. So that's all I want to share about me. But again, thank you for being here, everybody. Now I'll turn it over to you, Matt LaBreche. Thank you. Yeah, at my age, you have to walk.
Well, thank you guys so much for coming in tonight. It's very humbling to have everybody here to support the work that we've been putting together for the last couple of years. You know, as I've learned more about how things are here in the county, I've met so many wonderful people, and I really appreciate everybody being here tonight. Yes. How about now? Am I closer? That works? Okay. Okay, I will eat the microphone. All right, so as you guys know now, my name is Matt LaBreche. I'm a Rutherford County native. I grew up here and graduated from RS in the late 90s. And then I moved to Chapel Hill, where I went to UNC and earned my doctorate in pharmacy. I lived in the Triangle for 15 years with my wife and children, and then we moved to Utah. But then after COVID, we realized that we really needed the support system of our family and friends that were all back here in Rutherford County. So we picked up and moved back a couple of years ago. And when we moved back, the Rutherford County that I saw was hurting far more than what it was when I left. I desperately wanted to know what I could do to do my part to help. And so having no formal background or in the provision of social services or mental health treatment, I knew that I had a lot to learn. And that's when I started seeking out people with knowledge and experience that I did not have. And that's when I met Diane, learned about NAMI. And so together with Diane, I continued to expand my understanding of the current supportive service landscape in Rutherford County. So I would never attempt to enter an organization and dictate what they do with their efforts. So knowing that, 2 years ago I decided to found Allied Comprehensive Recovery Network as a 501c3 nonprofit. And then since then, I, along with my board members that are here today, we've systematically worked to try to visualize the supportive landscape and identify the opportunities where we might be able to improve it. So initially, I thought that the answer was residential substance abuse treatment services. And while that is absolutely needed, I feel as though I've gained a better understanding of the existing services and the possible opportunities that we can address short of creating a treatment center, at least for now. Still a big goal of mine. But tonight, my goal is to bring everybody together and share what I've learned so far. From here, I want to support a collaborative effort in creating a roadmap and a comprehensive plan for providing care for our community. I believe that voices need to come from the agencies and organizations providing the assistance, but they also need to come from the people who are receiving the assistance. In my vision, I plan to build a roadmap where everyone can use the same information as we work towards mutual goals. I'm not here to detract from anyone's existing roles or groundwork that's already been laid. Fortunately, I don't have to reinvent the wheel all the time. And I'm not here to cast a shadow on the importance of those that have been here in the trenches long before I moved back to my hometown. Just as a Rutherford County native, I'm here to do my part and contribute to a community that I deeply care for. So my goal is to facilitate all team and community members to excel at what they do best. So with that, let us get started. And I won't read everything from now on. Oh, before I get started, so the QR codes that I have here, I didn't get a chance to point those out to everybody. Probably most everybody in the room is aware of both of these, but I'm going to try to get the video online. So the first one, the Substance Use Disorder Survey, is a survey that I put together to try to get an assessment of the needs here in the county and the perceptions about substance use and mental illness. So we'll go over those results here a little bit later. And then the community resource guide that was put together by the Health Council of Rutherford County is very, very helpful, and everybody needs to have access to that at all times. So I know my goals are very lofty. You can ask my wife. She has said those goals are too lofty, but I think we can get them covered. Really, this is going to be just a very informative overview of the plan that I want to see us put in place. So the first goal, I want to briefly discuss the relationship between trauma, mental illness, and substance use. And then I want to highlight the magnitude of the challenges that are here within our community. After that, I want to illustrate the resources that are available from NAMI, and then after that, demonstrate the need for a shared roadmap of support. There's a lot of words, I know. I will read this one. So I want to make sure that we're on the same page as far as the language that we all speak and the understanding that goes into the topic that we're discussing. So what is mental illness? So mental illnesses are health conditions, and I want to make sure that I stress that, health conditions. And they're involving changes in emotion, thinking, or behavior, or a combination of those. Mental illnesses can be associated with distress and or problems functioning in social, work, or family activities. So then substance use disorder is a treatable, again I'm going to emphasize treatable, mental disorder that affects a person's brain and behavior, leading to their inability to control their use of substances like legal or illegal drugs, alcohol, or medications. So then putting those two together, the coexistence of both mental illness and substance use disorder is a co-occurring disorder or dual diagnosis. More often, more commonly these days, dual diagnosis is what people use. So that's probably what I'll use in our discussions. And then a new term that I became familiar with when I started looking into all of this is recovery capital. So if you think of capital like money, this is the breadth and the depth of internal and external resources that can be drawn upon to initiate and sustain recovery from severe substance use disorder problems. And that's broken down into four subgroups of personal, what do I have within me that can actually support my recovery? What social, so between me and individuals within the community, what community resources, so things like NAMI, things like ACRN are able to do, and then my cultural background and supports that I have, so that might be religious organizations, things like that. So very valuable to think of the resources that we have available to support people within the community with their recovery. So we need to understand what the common causes of mental illness are, and probably one of the most significant ones is going to be adverse childhood experiences. A lot of times people refer to those as ACEs. It's really any kind of trauma that a child is going to experience in their young age that really affects how they interact with the world moving forward if they don't address that trauma and know how to properly process it. For the sake of time, I'm not going to play the video, but when I do upload the slides, CDC has a fantastic video there, which is that hyperlink. I encourage everybody to check that out. So also experiences relating to other ongoing medical conditions like cancer or diabetes. So imagine if you're having to process something like that every single day, that becomes a very heavy burden that you have to navigate, and if you don't have the right tools, it can become overwhelming. Biological factors or chemical imbalances, the use of alcohol or drugs. A lot of times people think that using alcohol or drugs actually is a self-medication, and it is, but it's also possible to have some substances to trigger psychiatric issues like schizophrenia or things like that. So the reason that I highlighted and underlined and italicized, which is what I do when I want something to really stand out, having feelings of loneliness or isolation. The reason I really want that to stand out to us is because this is where we as a community have a really, really big role to play. We can actually have a very big impact, allowing people to know that they're loved, that they're not alone, and that they're not isolated. We can reach out to them and be there for them and not just be part of our job where we have to go, okay, well, how are you doing today? What are your things? Going to check off the list. Okay, bye. I'll see you next time, right? We want to be there for them. We really want to establish the relationships with them to help build their feeling of inclusion and not feel so lonely and isolated. So I have a whole lot of data, but I've trimmed it down to just a couple of slides. So the U.S. News and World Report, I guess they put it out every year, but the most recent one was from 2022, where they kind of look at every single county in the U.S. They make little peer groups, so Rutherford County would be paired with other counties that have similar economics and social components and things like that, so really trying to say apples to apples. So our county numbers are here on that far left column. So the metrics that we're looking at here, adults with frequent mental distress. That is 16.9%, basically 17% of our entire population said that they had frequent mental distress as of 2022. That is a lot of people when we have a population of 65,000 people. If you look and compare to all of the other groups, this is the only one where we come below our peer groups. So I guess there's something good there. But then deaths of despair, that's a fancy way of saying suicide, right? We have a lot of people who feel so hopeless that the only choice they see is to end their life. And that is 59.5 people per 100,000 in our population. And if you look across, U.S. is 47.5, a peer group, even people in communities like ours, that's 49.8. We're 10 people, human beings, higher than our peer groups, okay? So bear that in mind. I know you can't read the words at the top, and I will tell them to you, but first I want you to see these graphs. Feel the graphs. See what they say to you, right? The trend that we see, up, right? Everything up, up. The blue line is North Carolina, and the orange line is Rutherford County. We want those lines to be down. So the higher up we go, the worse off we are. Starting in the upper left-hand corner, that's housing 211 calls in Rutherford County. So that is people calling for housing assistance, homelessness, all of that. To put it in raw numbers, I think that's 868 people that called in 2021. Probably a lot more people needed the service, and this was just the ones that were captured. Okay. Next, we have foster care in Rutherford County. This is the percentage of children that are entering the foster system due to parental substance use. Not just foster care, it is specifically related to substance use. I talked about ACEs. This is a big ACE, right? This is a big trauma for kids, and if we don't have a system to support them, we're just going to keep seeing what we're seeing, okay? Bottom left, we have ED visits for overdose. We're going to need a bigger graph, and we've got to do something that's going to be able to really start to level that out and bring it back down. The state seems to begin to have it figured out, but we really, 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 really need help. And then that last one is actually deaths from overdose. The raw number is 40. We can talk back and forth about the validity of data and whether it's underreported or whatnot, but still, even if it's underreported, we're not slowing down. We're going up, okay? So this is the need that we're trying to meet here in the county. So I mentioned we have a population of about 65,000, and the North Carolina Institute of Medicine has a lot of data, but this particular number really stood out to me when I first ran across it. So the number of psychologists, psychiatrists, addiction psychiatrists, and pediatric psychiatrists. So let's think of that as the professionals that can actually help people in the clinical setting. Per 10,000, so that's how a lot of these data are reported. So for every 10,000 people, we have 0.9 healthcare workers. Not even one person for every 10,000 people. Whereas in the state, which only meets about 20% of our demand, we have 3.6 healthcare providers. So if we're only meeting 20% with the 3.6, we're far below that with the 0.9. Okay, so the healthcare professionals cannot do it alone. They need us in the community to be able to help. So these are rhetorical questions. I don't need a show of hands, but who knows someone that struggled with a mental illness? Could be a coworker, could be a neighbor, could be a friend, could be a family member. We probably all know somebody who's had a child that struggled with mental illness, especially after COVID. I mean, I think that we've all seen the reports of how severe the suffering and the trauma was for the kids with getting ripped out of the schools and having to learn how to homeschool and all that. So that's something that has only made our healthcare system a lot more strained. Who's personally struggled with mental illness, right? Were you able to talk openly about it? Were you able to approach anybody? Was there stigma? Was somebody, looking at you or treating you differently because of the chemical imbalance that's in your brain? For everybody that's had an experience with this, who knew exactly what to do? Did you know what resources to reach out? Did you know who to talk to, right? So my guess is that unless you do it for a living, you probably didn't. And even if you do it for a living, you may not even know all the resources. So I'm wearing two hats tonight. First hat, NAMI hat. Diane's already given a pretty good introduction, but I want to kind of go through the points that I've got here. It is the nation's largest grassroots mental health organization. And I hate that I didn't hear about them until I moved here, but I'm glad that I did. So there's more than 600 local affiliates, so NAMI South Mountains is our local affiliate, and 48 state organizations. West Virginia and North Dakota do not have one. The vision of NAMI, they envision a world where all people affected by mental illness live healthy, fulfilling lives supported by, and again, I've underlined, bolded, and italicized, so we know it's important, a community that cares. Right? We have to be a community that cares for the people around us because the health system cannot do it alone. And how do we do that? We give hope, we make people feel included, we give them a sense of empowerment, show compassion and fairness to them. That is a great way to make someone feel good about themselves if they're feeling completely alone and isolated. There are a lot of NAMI programs. There are 16 that I've been able to find on the NAMI website, and I'm learning about them as I go. I'm not going to go into each of them in extreme detail. We have some papers back there behind my family, a lot of brochures explaining what each of those programs do. But these are administered and presented by people with lived experience, people who understand what it's like to be with mental illness. These presentations are one-off things, so they can go into schools, they can go into certain groups, and they can really speak to a very specific portion of the population. We've got NAMI classes. They're a little bit longer, they're more involved, they're more informative. But again, these are dialed into specific groups of people that, it really speaks to what the needs are of each of these individual groups. And then since NAMI does a lot of outreach and advocacy, there are several programs there. One that I wanted to point out, and my initial hope was for this gathering to have a lot more of our churches represented. FaithNet is designed to approach people with the understanding of their faith, to understand how important and valuable that piece of recovery capital is, and really speak to those populations, but also give education and information on the root causes of mental health and mental health disorders. And there's also support groups which are held regularly. Our NAMI South Mountains team is incredibly well-trained in administering, overseeing, presenting these groups. For an organization that has as few members as we do, we really knock it out of the park with what we can do with the people that we have. So here's my plea for why NAMI. So like I mentioned, it's a highly localized affiliate, which can really dial in and reflect the community-specific needs. Anybody can join, so it's not going to be selective, and so we wind up hearing more diverse voices, and we really get a truer picture of our community. We have access to standardized evidence-based resources, and those are from a nationally recognized organization. So I mentioned reinventing the wheel. We're not reinventing the wheel again. And there's a broad variety of points at which to engage. So I mentioned all of the 16 different NAMI programs, but there's even more than that. We can actually be a contact point for individuals to reach out to provide assistance and really to make them feel included and supported. It's a nationwide group of like-minded individuals that can support and collaborate, so we're not on an island, right? We've got resources that we can reach out to and leverage that can really magnify the impact that we have for people. And because it is a national organization, we've got the structure to where we can actually reach out to people at higher levels, so state and national levels will be heard by our voice here, magnified by NAMI. And if it wasn't enough, it's free. So what I think growing NAMI means is that more people within the community have the tools that they need to support themselves and to support the people that they love, okay? I mentioned also that our lean and overburdened mental health system needs help. So growing NAMI, really training up individuals to be able to support their neighbors, their loved ones, is going to take a lot off of that system. So instead of having 0.9 per 10,000, it's really going to feel like a whole lot more. If we can really rally the entire community, then it's, we may even get 1-to-1, who knows? But coordinating resources to support our vulnerable populations is going to be something that I think NAMI is really poised to be able to do. And so the way that I see this kind of working out, and we're going to start blending into my ACRN hat, but trying to see how NAMI can reach out and support the community. So the first little puzzle piece that I have here is a local mental health resource line. So if we get people in the community to be able to staff a resource line where someone can call in at any time, we have our resource roadmap, which I'll go into a little bit later. We can give them consistent care. We can give them consistent contact. We can also give them someone that can basically work as a big brother, big sister, or a shepherd or a chaperone to work through the mental health network. So if we get a consistent plan for how to actually address the needs of the people in our community, then this resource line would be able to leverage that quite well. Internal support teams, the way I see it is we all want to help support ourselves. I use a lot of analogies. So, if you're on an airplane, you got a small kid, door pops open, oxygen mask comes down. Who gets the mask first? I love my kid. I want to put the mask on first, right? No, I got to put my mask on first so that I can take care of the kid. So this is what I see NAMI being able to do, is actually provide that internal support for the people that are actually trying to go out and provide the support for the community. I mentioned that we have a lot of facilitators and trainers. I think that we can even build that to be a greater amount so that we can really spread the impact that NAMI has. Lived experience teams. I've had some really good conversations with Marshall. He's got some great ideas on how we can really do outreach within the community to be able to say, hey, I've been there. I know what's going on. I've made it through. Here's how we can help. Let me walk you through, right? So these lived experience teams would be very, very valuable, especially trained with the information that NAMI is able to provide to them. So resource-specific teams. So maybe there's a resource within the community that needs some extra help, right? Maybe Pat Chamberlain down at Out of the Ashes needs a group to help do some support. We can be that resource that he leverages to be able to do additional help for the community. School, church, jail. 3 great places to do outreach, to really start working and supporting people. Educate the kids in school. NAMI's got great programs for that. Church outreach teams. Like I said, we've got the Faith Net and Bridges to Hope. That really would be critical to bring everybody together and give a shared sense of direction. And then jail outreach. To my knowledge, I don't believe that we have a jail outreach program, at least not officially very robust, but we need to get people when they're in jails so that we can begin to give them the support, to give them the mental health care that they need to really get them set up to come out and be able to hit the ground running rather than just getting out and just like, what do I do now, right? So this is how I see our ability to work together under the banner of NAMI to really do a lot of good for our community. And if you notice, we've got little places on the puzzle piece where we can add more pieces. I don't know everything. I don't pretend to know everything, but I think this is a good place for us to start. So here, and hopefully I'm still on the internet. Come on. Come on. Oh, we got to be able to do this. Duplicate. Yeah, all right, technology wizard. Okay, so for everybody that hasn't taken the survey, I would humbly request that you do. These are the questions that I ask in the survey, but these are the results that I've gotten from it. So one question that I ask is, in your opinion, what are the top 3 causes of drug addiction or substance use disorder? Does it look like we have an agreement? Does it look like there's a really clear winner here? To me, it kind of doesn't. It looks very mixed, right? We've got self-medication and stress and coping, which I probably could have combined as one. Peer pressure, curiosity, media and pop culture, lack of education, moral failing, genetics, and rebellion, right? Really just a mixed bag. And that's kind of what I would expect, right? Not everybody gets to where they are for the exact same reasons. We have a multitude of factors that play into getting people into substance use disorder. Is drug addiction or substance use disorder a significant problem in Rutherford County? I would have been surprised to get anything other than 100% yes. So we can all agree that we need to do something. This pair is very entertaining to me and very telling. So the first one there on the left, do you believe you have a good understanding of the causes of drug abuse? What, 80% said yes, 20% said no. Next question says, do you believe that the general public of Rutherford County has a good understanding? It's pretty much flipped, right? So how can we have a really good understanding, but nobody has a really good understanding, right? That is the disconnect that we have right now as far as education and understanding with the causes that get us to where we are right now as a society and a community. So do you believe that Rutherford County has enough resources? The vast majority said no, and some said yes. You know, maybe we do. We have a lot of resources here. We have a lot of people that care. We have a lot of people that are really willing to do everything that we can to support people, but maybe the resources are not quite allocated the way they need to be. So then I asked expansion of which 3 resources would have the greatest positive impact, right? So hard to see a clear winner there too, right? So I've got it where we have weighted averages, and so that's how I was able to kind of put them in order. Residential or inpatient treatment? Well, everybody thinks like I did when I first got started. Education, I like that. Food assistance, detox services, overdose treatment, childcare, medication-assisted treatment, counseling services, affordable and drug-free housing, employment, legal assistance, and then structured support groups. That's the way that these were ranked as what would be the most significant impacts on helping our community. So that said, if you were looking for resources to support someone struggling with drug addiction or substance use disorder, how difficult would it be to get the ones that I mentioned up top? It's a little cleaner, right? Very, very resounding number one, affordable and drug-free housing. I don't know if everybody knows kind of the low-income entry point for people in Rutherford County, but tends to be our motels. For the most part, they're not really conducive to recovery and support. So having access to affordable and drug-free housing is clearly a very important priority. And then we have residential and inpatient treatment, which I agree, very important. But then we have employment, detox treatment, legal assistance, medication-assisted treatment, child care, counseling services, structured support groups, education, overdose treatment, and food assistance. Food assistance was number 3 that we needed to improve that. But the reality of it, what people see in day-to-day life, is that the churches are doing a fantastic job of providing food for people when they need it. That's what I want to celebrate, right? We're doing some things right. We have access to overdose treatment. United Way has access to overdose treatment, and they're making sure that's out in the community. But the disconnect between what people think that we need and what people say that we need is, there's a pretty big gap there. And so this is part of the education that I believe that we need to get out to our community to help really define where we want to focus our efforts. I asked if people would be willing to join the effort. A resounding majority are yes. And that really, if you look over to the next multiple colored graph there, every one of those areas has people that are willing to volunteer. So it's not that people aren't out there, it's just people don't know exactly what to do or where to plug in. And that's what I want to do with the efforts that we're doing here. All right, that is not what I want. Come on. Project. Extended. Let's try that. Excellent. All right, hat switch time. So I mentioned that 2 years ago, I founded Allied Comprehensive Recovery Network. For the longest time, I've called it ACRN, but really the reason I picked the name was because it looked a lot like acorn, but you'd pronounce it ACRN. So I've decided just to use the lowercase o, and now, from now on, ACORN. We're going to be ACORN. It is a brand new 501c3 nonprofit, and like I mentioned, we're dedicated to identifying and closing the gaps in care. And really, I can't stress enough that our success is really going to be dependent on the amount of community involvement, because I've been doing this kind of out of pocket for the last 2 years, and I don't have unlimited funds to be able to do that, and I don't have enough of me to go and talk with everybody in the county enough to make a big difference. So really the approach that I want to take with ACORN is I want us to approach people and say, how can we help learn about what's happened in your life? How do you need our help? I don't want to go and say, let me tell you how to do it. This is what you need. Let's do it. Let's go. It's a hard thing for me to overcome. If I feel like I know what the right answer is, I'm really going to fight hard to not tell you exactly what the answer is, but I need to listen. Right? I need to know what your needs are, because your needs that are the most important to you may be completely different than what I'm seeing just externally. So, speaking of needs, this is something that I ran across very early in my learning process, and I think that it really does a great job of sort of demonstrating the things that we need as human beings to function and exist well. If you look at this triangle, kind of think of it in 3 dimensions, because basically it's a pyramid, right? So if we build our pyramid from the bottom up, that's how it works. You don't build the top of the pyramid and then figure out the parts in the middle and then do the bottom and back up to the top. You have to build the pyramid from the bottom up or it's going to fall down, right? So on the bottom, physiological needs: food, water, warmth, rest, right? Things that your physical body needs to survive. If you don't have these, do you think that you're going to be able to feel great about yourself? You think you're going to be able to really go out and do your full potential? No. Your primary focus is going to be making sure that you do not die. After you get those met, you move up to your safety needs, right? Security, safety. One thing they didn't put on here is housing. Housing is a very important part of safety. Then after you get those basic needs, that bottom bracket taken care of, you can move up to the psychological needs, belongingness, love needs. So that's the relationships that we have with people around us. This is where, again, I want to emphasize we have a very big impact on those around us. Esteem needs. Now we've gone from outside to inside, really focusing on what we have as our tools and our ability to feel good about ourselves. As a community, we can support people to give them the opportunities to excel and feel that sense of accomplishment. And then if you manage to get up into the self-fulfillment needs, the self-actualization allows one to reach one's full potential, including creative activities. So again, look at this, understand that we need to build a pyramid from the bottom to the top. So what happens if we don't build the pyramid from the bottom to the top? Okay, well, let's neglect our bottom, okay? Physiological, physical illness, right? If you're hungry, that is a response to a physiological need not being met. Safety. If you don't feel safe, you better believe you're going to feel anxious, right? If you live in a place where you do not feel like you are going to be able to live comfortably and safely, your body is designed to have anxiety. It's not something that's wrong with you. It is years and years of human existence fine-tuned to keep you safe, right? Love and belonging. You feel lonely. If you don't feel like you belong in a group, maybe you might want to just push people away. I don't need you guys anyways. You don't love me, I don't love you. I don't need you, right? Antisocial behavior, very, very likely if we're not meeting the needs of people's love and belonging. Esteem. Feelings of worthlessness, feeling invisible, unappreciated, low self-confidence, and depression. I'm moving up the pyramid, and it's starting to feel like maybe it's easier to fall into these unmet needs portions. So just be aware that it's difficult to make sure that even we as people that are trying to be there and supportive, that we're able to meet our needs, right? So if self-actualization, you get bored, feel cynical, have a lack of meaning in life, right? Being bored, that's pretty easy to do, which is, I guess, why we're addicted to cell phones these days, but that's another topic. So just being aware the real life presentation of not meeting the needs of individuals, it makes a lot more sense when you look at it this way. At least it does to me. So what do we need? We need to design a program for building pyramids. So how can we as a community coordinate a system that effectively addresses each layer of the pyramid? What are the true needs of the individuals? So that's when I get back to saying, what do you need? How can I help you? Not, here's how I'm going to help you, right? Do we have the right kind of support in place right now? Do we have redundancies? Do we need to reallocate priorities and resources where they are? I don't know. That's my question that I'm asking to you guys. And so how do we do that? It's going to be with a systematic approach. What I'm wanting to accomplish today is to begin centralizing a contact list of people that are wanting to engage in this effort. So NAMI has a lot of resources, and NAMI would be a really great place to plug into to begin building that group of people. Once we do that, then we can put it out to the groups and say, okay, you're interested in the youth, you're interested in housing, you're interested in transportation. We get groups together that regularly meet and create action items with timelines. not here's show and tell, here's what we talked about this time, see you guys next time. We cannot afford to just keep talking about what we could be doing. We need to actually implement doing something. So this is my big announcement for today. My attempt at doing something, at least to deal with the housing situation, I was able to purchase a 10-acre piece of property in Spindale on Tuesday. So perfect timing for our little presentation today. I don't know, you probably can't see, but this is Fairground Road. Anybody know what's on Fairgrounds Road? Health Department, DSS, library, transportation, all of that right there. What's that? School buses, lots of school buses. Narcotics office right there too. Veterans Agency, yep. Could anybody find a better place to put housing for people that need support in the community? I couldn't, that's why I bought it. So what I plan to do is to get repurposed shipping containers, build them out to a house. So if you see the floor plan there at the bottom, I'm actually getting someone to draw up those floor plans right now. And I want to arrange them, so that pink little diagram up there, I want to arrange them in little pods, right? So, and it may not turn out exactly like this, but the vision I have right now, so I've got 5 of these houses sort of semicircled along the road there. 4 of those houses are going to have people that are coming out of programs like Out of the Ashes, coming out of programs like Phoenix or other inpatient treatment centers, Pavilion, for example. We can house 2 individuals in each of those spaces. So, you know, if you've come through detox and treatment, and you've come through detox and treatment, you need a place to stay, you're both going to be in here. Keep an eye on each other, right? It's support. This is going to be a community of support. One of these houses is going to be a peer support specialist. So we're going to have people on site at all times, making sure that you're following along with the supportive regimen that we come up with. I've got a good bit of it already detailed out, but you know, are you getting up every morning and making your bed? Are you going to work? Are you going to school? You know, are you cleaning your space? Do you need housing, or do you need transportation? We work together with agencies in the county to be able to do that. So this is going to be a very big piece of satisfying that number one most difficult thing in the county to find. But again, I can't do it alone. I need help from the community, and I believe that once we get this set up, we're going to really see a big difference of people feeling actually supported and actually move forward to say, oh, I have a goal. I can stay here as long as I need to. I know I'm safe. I know that my needs are met. I can really begin to move up that pyramid and build what I need in my life. So with that, this is my contact information, Diane's contact information, QR for the NAMI website, and then the ACRN website there in the upper right. So thank you guys for listening. Hopefully I did not take too long.